Hi, I'm Jan Sensier. I'm the Executive Director for Partnerships and Strategy here at the Trust. I started at the Trust in April 2022, and this is my first job in the NHS. So I've had a very long career in lots of different bits of public service. I started out in job centres. In fact, my first job, for those of you who know it, was at Bulwell Job Centre, which is in the middle of Bulwell, one of the places where we've obviously got services here at the Trust because we've got Highbury Hospital located in Bulwell. I moved around Nottinghamshire. I worked in lots of different job centres, including in Netherfield and Worksop. And then I branched out into Lincolnshire and worked all across Lincolnshire, again in job centres, and then had regional and national roles. I then moved into something called the Government Office for the East Midlands, which represented 11 different government departments, working very closely with local authorities, with health services in fact, and being that kind of link between central government and local government, representing central government but also listening to what was going on the ground and being able to tell the story back at Whitehall about how things really were on the ground. I loved that job, but in 2010 the government offices were closed down. It was part of the bonfire of the Quangos that took place at that time, and I found myself looking for a new job. I was very, very fortunate to go into an interim role as the Executive Director of East Midlands Councils. That was an organisation that represented all the 46 different local councils in the East Midlands, and my job was to work very closely with council chief execs and council leaders to represent them and offer them services across a range of different areas. I did that for 18 months. It was, again, great. I've been very fortunate in my career, but it was an interim position which came to an end at the end of 18 months. And then I had my first really close-up experience with health, and I took a job as the first and founding chief executive of a very new community interest company that was called Engaging Communities Staffordshire, which was set up in the wake of the mid-staff scandal. And it was set up by the NHS and the County Council in Staffordshire to be a place where it could be a central repository of all the feedback and all the information about health and care services in the county. My job was to represent the public. I had to have a public face, so I found myself appearing on BBC Radio Derby and Radio Stoke very regularly. I was also found myself a bit at the eye of the storm because soon after I took up post, the Francis inquiry was published, and I was being interviewed about that. And also in mid-staffs, the hospital was being taken over, services were being moved, the A&E maternity services were being moved, public were protesting. I had to chair public meetings with 1,000 people waving banners. It was very scary. But I got to know an awful lot about the NHS through that. I got to know about services. I represented the public on lots of different meetings, in quality committees, in clinical governance committees, the Health and Wellbeing Board, and it really helped me to gain an understanding of the complexities, the difficulties, the challenges that face the NHS in the 21st century. So it was a very good education. I did that job for 5 years and then went back into the civil service at the Office of the Public Guardian that deals with mental capacity and lasting powers of attorney. And I was the Deputy Director for Strategy there, developing a transformation programme on how lasting powers of attorney are managed. After a couple of years there, it became March 2020 and the pandemic struck, and I was asked to go back into the centre of government to represent, again, be that link between local areas and national areas to help with the pandemic response. And I worked with several local resilience forums dealing with things like PPE equipment and all those horrible things that we were dealing with at the beginning of the pandemic. And then I went into what is now the UK Health Security Agency, again with regional teams across the country, identifying what was happening on the ground and representing that back up to Whitehall and taking part in all the bronze, silver, gold calls at a national level. I count myself extremely fortunate to have joined the Trust. I live locally. I've lived in Nottingham for over 30 years, just down the road, in fact, from Duncan Macmillan House. And this job, when I saw it advertised, seemed to pulled together so many different threads of my career, because my job is to represent the Trust in that partnership landscape, which is really quite complicated, with things like provider collaboratives and place-based partnerships and lots of other things you'll have heard of. What I hold on to is that my job is there. We were at a time, weren't we, in the NHS when it was all about competition and commissioning, and now it's all about collaboration and how we work together for the best reasons to support our patients and the public we serve. My job is to make sure the Trust is a good partner, that we do work together and that we really make the system work in the best way possible for our patients. I can't think of a better job, and I'm absolutely privileged to be here.